Good morning and good evening to all our virtual classmates. Our topic for today will be about cerebral palsy.
A new definition proposed in 2006 describes cerebral palsy as a group of permanent disorders of the development of movement and posture, causing activity limitation that are attributed to non-progressive disturbances that occurred in the developing fetal or infant brain. So, in addition to motor disorders, the condition often involves disturbances of sensation, perception, communication, cognition, and behavior, secondary musculoskeletal problems, and epilepsy. Cerebral palsy, or CP, is the most common permanent physical disability of childhood in the United States. One systemic review and meta-analysis indicated a prevalence of 2.11 per 1,000 live births, with the highest prevalence among infants born weighing 1,000 grams to 1,499 grams at birth. The prevalence of CP was higher among infants born prior to completion of 28 weeks gestation.
Etiology: Cerebral palsy is caused by a problem that affects the development of a baby's brain or brain injury while it's growing in the womb or birth or within the first 2 to 3 years of a child's life. So, risk factors of cerebral palsies are low birth weight and preterm birth, multiple gestation, infertility treatments, infections during pregnancy, and fever during pregnancy. Another risk factors for cerebral palsies are blood factor of the mother and fetus does not match, exposure to toxic chemicals such as high level of methyl mercury, maternal medical conditions, complicated labor and delivery, jaundice, and seizure. So, for risk factors for acquired CP, infancy, preterm or low birth weight, not getting certain vaccination, and injury.
Clinical manifestations. Cerebral palsy may be suspected if a baby has the following: developmental delays. This is when a child is too slow to reach the milestone, such as rolling over, sitting, crawling, or walking. And this is the number one clue that a child might have cerebral palsy. And next comes abnormal muscle tone, which is when their body parts are either too floppy or too stiff, and abnormal posture. And this is where the child favors one side of the body, either when they're crawling, walking, or just otherwise moving. These three signs are the number one indicators for cerebral palsy in an infant. Beyond the main three indicators for cerebral palsy, there are a host of other symptoms that a person can have when having cerebral palsy, and it differs from person to person. But these symptoms generally include ataxia, which is the loss of muscle coordination when making movements, spasticity, which is stiff or tight muscles, jerky, repeated movements, and stronger than normal reflexes, weakness in arms or legs, walking on the toes, or walking in a crouched position. There's also muscle tone that is either too stiff or too floppy, drooling, trouble with swallowing or speaking, shaking or tremors of the arms, legs, hands, or feet, or sudden uncontrolled movements. There's also delay in motor skills such as sitting, crawling, or walking, as I mentioned before in previous slide, and also trouble with precise movements such as writing or buttoning a shirt. And it's very noticeable in children that are going through these developmental milestones, and as they're supposed to be learning and developing their motor skills, this is a time where their fine motor skills are especially being developed. And when they're unable to perform these certain tasks that they should be able to at this age, it's a major indication that cerebral palsy may be present in that child. Besides muscle movement symptoms, we can also see intellectual and developmental disabilities, seizures, feeling unusual physical sensations, vision problems, and hearing problems as signs and symptoms for cerebral palsy in children.
Diagnostic and laboratory tests. For the MRI, it uses radio waves and a magnetic field to produce detailed 3D or cross-sectional images of your child's brain. Then the cranial ultrasound. It uses high-frequency sound waves to produce images of the brain. An ultrasound doesn't produce a detailed image, but it may be used because it's quick and inexpensive, and it can also provide a valuable preliminary assessment of the brain. For the electroencephalogram or EEG, if your child is suspected of having seizures, an EEG can evaluate the condition further. The EEG records electrical activity of your child's brain. For the laboratory test, if tests on the blood, urine, or skin might be used to screen for genetic or metabolic problems. For additional tests, if your child is diagnosed with cerebral palsy, you'll likely be referred to a specialist to test your child for other conditions often associated with the disorder. These tests can identify problems with intellect, development, movement, vision, hearing, and speech.
The musculoskeletal manifestation of the cerebral palsy change with growth, necessitating orthopedic management. So the goal of the orthopedic management is to help each individual to reach the optimal functional ability and to prevent deformity. So the goal of surgical intervention is also to improve the function, to decrease discomfort, and to prevent the structural changes that may become disabling. So the surgeries most common to this cerebral palsy usually falls under the following categories. First one is the gastroenterology surgery. So this aims to improve the process of feeding, digestion, and bladder or bowel functioning. Next is the hearing correction surgery. So the children with cerebral palsy are also prone to nerve or sensory neural hearing loss due to a defect in the nerve fiber. So next is the medicine-related surgery. Children are experiencing chronic pain in need of constant and consistent doses of medication. Next is the orthopedic surgery. The orthopedic surgery is considered when other less invasive treatments and therapies have been exhausted without success. So this can be performed on joints, bones, ligaments, tendons, muscles, and nerves. Next is the neurosurgery. So this is performed on the nervous system, especially in brains and spinal cords. Lastly is the vision correction surgery. So this can help to improve vision impairment and loss. So the vision surgery usually addresses problems with the eye and the retina, but it can involve the muscles that support the eye functioning.
Provide reassurance, acceptance, and encouragement, especially during times of stress. Strengthen family support. Utilize the family's strength to influence patients' health in positive direction. And then, next is prevent injury and deformity. Prevent physical injury by providing the child with a safe environment, appropriate toys, and protective gear such as helmets and knee pads if it will be needed. And then to prevent physical deformities, we have to ensure the correct use of prescribed braces and other devices by performing ROM or range of motions exercises. Encouraging the child to perform age and condition appropriate motor activities. Increase oral fluid intake. We have to promote adequate fluid and nutritional intake to our patient. Next is manage sleep and rest periods. Foster relaxation and general health by providing rest periods. And then, we also have to enhance the self-care. Encourage self-care by urging the child to participate in activities of daily livings or ADLs, such as using utensils and implements that are appropriate for the child's age and condition. Facilitate communication. Talk to the child deliberately and slowly, using picture to reinforce speech when needed, and encourage early speech therapy to prevent poor or maladaptive communication habits, and provide means of articulate speech such as sign language or a picture board. And then lastly is to enforce therapeutic measures. Assist in multidisciplinary therapeutic measures designed to establish locomotion, communication, and self-help and gain optimal appearance and integration of motor function.
That's it for our presentation on cerebral palsy. Hope you enjoyed and learned something on our report. Thank you.